Hello. Today my presentation is about methotrexate. My name is Zainab Ahmed, and this is for cell biology. So now we're going to talk about the mechanism of drugs of methotrexate. So methotrexate inhibits dihydrofolate reductase (DHFR), the enzyme that reduces folic acid to tetrahydrofolic acid. Tetrahydrofolate must be regenerated via the DHFR catalyzed reaction in order to maintain the intracellular pool of tetrahydrofolate 1-carbon derivatives for both diamidylate and purinucleotide biosynthesis. The inhibition of DHFR by folate antagonist, which is the methotrexate, results in a deficiency in the cellular pools of diamidylate and purines, and thus in a decrease in nucleic acid synthesis. This means that methotrexate interferes with DNA synthesis, repair, and cellular replication. Methotrexate is most active when rapidly multiplying cells because its cytotoxic effects occur primarily during the S phase of the cell cycle. Since cellular proliferation in malignant tissues is greater than in most normal tissues, methotrexate may impair malignant growth without irreversible damage to normal tissues. As a result, actively proliferating tissues such as malignant cells, bone marrow, fetal cells, buccal and intestinal mucosa, and cells of the urinary bladder are in general more sensitive to DHFR inhibition effects of methotrexate. So the clinical study we're going to look at is called Clinical and Radiological Characteristics of Methotrexate-Induced Acute Encephalopathy in Pediatric Patients with Cancer. And in this study, the method used, the authors, they reviewed clinical and magnetic resonance imaging, which is MRIs, of pediatric patients who were treated with methotrexate and had symptoms of acute cephalopathy within 2 weeks of the actual treatment. The goal of this study was to try to figure out if there was a relationship between pediatric acute cephalopathy and high dose of methotrexate administration. And this is because not much known is how pediatric acute encephalopathy actually occurs. So this is figure 1, and figure 1 is patient 3. She's one of the ones who had symptoms. So she's a 14-year-old girl being treated for T-cell acute lymphoblastic leukemia. And she had experienced headaches for 4 days. She underwent MRI on day 4 when alternating hemipheresis, dysphagia, and confusion were observed, and the imaging A is on day 4, and imaging B was 5 months later. So at presentation, T2 Wade and FLAIR images were near normal, but diffusion Wade imaging, which is DWI, showed restricted water diffusion in the deep white matter of both cerebral hemispheres and low signal on apparent diffusion coefficient ADC, which is the last imaging map. And you can see the abnormalities shown by the arrows. And then at the follow-up B, which is 5 months later, a small focal signal abnormality was apparent in the left periventricular white matter on T2 and FLAIR. So they found abnormalities that weren't there before, while DWI revealed increased diffusion. That's the third one, and they saw that there was increased diffusion. The diffuse supratentorial white matter areas of restricted diffusion had returned to normal. And they were talking at that point. They were talking about the last image. And so from this research study, they found out that they couldn't make a direct connection of methotrexate induced acute cephalopathy, but if pediatric patients have any symptoms of encephalopathy, they should go get imaging done. So cancer mortality during 2000 to 2010 was higher for both Black men and women compared to white men and women. And then the 5-year relative survival rate for people who were diagnosed with cancer from 2011 to 2017 and followed through 2018 in countries with a median household income of greater than 75,000 and lower than 35,000 per year was 71% and 57% respectively. As you can see, there's a difference between the income of the household and the treatments that they went in for. And what I think is the solution, because there is a lot of disparities in the U.S. healthcare system right now, would be a universal healthcare system. And an article I found actually showed that out of many countries, the U.S. had the highest incident rate for many races, but only Black people had the highest mortality rate, which was really interesting. And then countries with universal healthcare had lower incident rates and mortality rates when it came to cancer. And this, if we change to a universal healthcare system, this would mean that everybody would be able to get help. Whether they were poor or rich. And even if there are flaws in a universal healthcare system, everybody is still getting the help they need.